The statement has two parts. The plan your work is the first, and which really is the recipe for success. The second part, work your plan, I'm going to address later. So let's look at this. We heard this, that by failing to prepare, you are preparing to fail, a very famous quote from Benjamin Franklin, and why has he said this? Let us look at some of the other quotes that will make it clear. Planning is bringing the future into the present so that you can do something about it now. So the problem that you're going to face, you are addressing it before. Secondly, very important, a clear vision backed by definite plans gives you a tremendous feeling of confidence and personal power. And if you do any procedure with confidence, you're going to get a better result. Now, planning a knee arthroplasty, I think basically you are doing two things. One is you planning your arthroplasty practice, and second is a particular case. When I started practice in '95, I decided to do only arthroplasty as my practice, getting stimulated by what Dr. Sir John Chanley wrote in his preface in one of his books, that this surgery is so intricate and demands so much attention that one should practice only this, and I decided to do that. But what it gave me was tremendous time and planning possibilities to make sure that when I start doing them in numbers, I would be successful. The second, in 2004, when I wanted to implement CAS in my practice, as soon as I realized that computer can give you better alignment compared to the mechanical instruments that we were using, the next daunting task was to implement it, because we had heard that a lot of people started using CAS and gave up at an early stage. So what I did was I set up a lab, more of a workstation with the help of BrainLab and Depew at their Mahim office, and for a month practiced on the Sorbonne. Then took my staff to come and see what I was actually going to do. Had a dry run in the theater itself. I had a biomedical engineer appointed for 6 months with me who made sure that the computer wouldn't shut down. He went to an extent that he put some of the sticky tapes on the cables so that nobody walking around will unplug the computer while I was operating. And the result was even the first case went very smoothly and successfully, and within a month, we started using CAS for every patient. And over the last 16 years, today, even if I do 5 cases in a day, I use computer navigation. Started using it for some of the revisions, particularly unicondylar, which are increasing currently. Now, planning a particular case for a successful TKA, there are a number of aspects that you need to plan for. Let's give you some tips from my practice for each of them. First, you never want to operate the wrong side, so one can adopt signing your leg. I write "not me" on the opposite leg very clearly so that I've never really had this problem. When I do bilateral, I write 1 and 2 so that the more troublesome knee gets done first, just in case it gets postponed after the first. Need to have fitness assessed well in advance, particularly cardiac and pulmonary, because these are cold operations and elderly patients. And if they have any of those issues, I never give in to do a bilateral knee for this patient. The two other things, risk of infection and risk of DVT is the real challenge, and you need to do a lot of investigations before, particularly looking at their protein levels, albumin, and total leukocyte count. Any history of DVT or infection in the past should not really be ignored. And all this should be done 2 or 3 weeks prior to the surgery so that it gives time to you to correct them if need be, and you can avoid cancellation unnecessarily. Preparation for the setup, whether you have a clean air, whether it is working at the correct pressure, body exosystem. You don't need to have all of this, but if you don't, then make sure that number of people in the theater are less, the traffic in and out is less, so that you can minimize the contamination. You also need to study whether you need standard tourniquet or you need a sterile disposable, particularly for a fat patient with a short thigh, you might need that. Most important other part is preoperative antibiotic timing and that of TXA, and we've published a number of articles on this, that the most important dose is the preoperative dose. And even after 7,000 knees today, before I scrub up, I ask the anesthetist, has the antibiotic gone in? One other tip, if you have a theater temperature which is not so good in the theater, then put your cement in the refrigerator. That will give you that much extra time to work with. Special needs, at the end of my consultation note, I put a star for some of the patients, which tells me that I might need a constraint, I might need stem, or I might need special instrument to remove the implants, so that you don't enter the theater without having them. The next most important thing is the surgery, and I'll touch this in a minute. Recovery, whether standard protocol will do or you want to alter it for some of the patient. Vigilance in the post-op period, looking at total count and CRP, extremely important, so that you can discharge the patient once you know that patient is out of the danger zone of infection. And we published this, I presented this at Knee Society a couple of years back, that I used to follow CRP all the time, but by the time you know that the CRP has come down, it is 4 or 5 days. Whereas if you follow interleukin, on 48 hours, you know that the patient's interleukin has come down and patient is out of the danger zone. To give you some examples of the case here is this doctor patient wanted to have his knee done, but only in one stage. With such an extra-articular deformity, I was keen to do it in 2 stages, because if I made a 90-degree cut on the femur, it would have cut the lateral collateral attachment. But with a little bit of planning, I decided to do a controlled varus cut using the computer navigation that helped me save the lateral collateral attachment. I cheated a little bit on the tibial side by putting it in 1-degree valgus. Overall alignment was still within 3 degrees with an excellent outcome. Here he is at 1 year, and this is at 8 years. And I've done a number of cases using the same technique, same planning, even with extra-articular deformity on either side, correcting in 1 stage with controlled varus cut. Her opposite knee was again looking as if it cannot really be done in 1 stage, but with the planning that was possible and with computer navigation. This case, I had done the first stage again for this patient because she came with an infection even after first stage was done and had some pain in the knee just before the operation. So I looked at it carefully and I thought that there is a crack fracture on the only existing medial epicondyle. Now, during her first stage, I had written that I'll need a hinge and that should be fine. But now I thought that I will need something probably more than this. And good that I kept the distal femur replacement prosthesis, tumor prosthesis, which I needed. In this patient who me and my colleague and friend, Dr. Vinod Agrawal, were to do, was sent to us for distal femur replacement. But both of us were planning and said we need a proximal femur to see if the tumor has progressed further, and on the table it had. Luckily, we kept the total femur replacement prosthesis available, which we needed to use, and it produced good result. Now coming to the second part of the statement, which I think is the most important part. Work your plan. If the first statement is the key, recipe for success, the second is the key to success. And the one needs to go about with this, that it is the surgery. You need 2 parts. You need to do a mental preparation for the surgery. Rehearsing it in your mind the previous night, again and again, will let you execute that surgery smoothly when you actually do it and get a success. So in summary, to ensure a winner in arthroplasty of the knee, careful planning, mental rehearsal again and again, and a careful execution is needed. And I'm going to leave you behind with this quote from Abraham Lincoln. He said, "Give me 6 hours to chop down a tree, and I'll spend the first 4 sharpening the axe." Thank you very much for your attention.